Smoking in pregnancy or tobacco in pregnancy is a difficult topic. You know that there's concerns. You wouldn't be here if you weren't looking at this. I won't tell you everything there is to know, but if you get anything from this talk, I hope you get the desire to find out more information and to work with your healthcare provider to try to decrease and hopefully eliminate tobacco use, nicotine use during pregnancy. In my experience, pregnant women who are smoking have the idea, at least, that it reduces the size of the baby, makes a smaller baby. In fact, it may come as a surprise to you to know that many years ago, obstetricians would recommend to women who had large babies to smoke to reduce the size of their baby and reduce the risk of problems with a large baby. So even physicians in healthcare many years ago didn't realize all the risks of smoking and tobacco use in pregnancy. So a baby is, in fact, the growth is affected, but that growth being affected also increases the chance of almost all complications in pregnancy, including bleeding episodes, abruption, even baby not making it, surviving pregnancy. Abruption is when the placenta separates and pulls away, and there is bleeding and can lead to an early delivery, can lead to a baby being in the intensive care unit, can increase the risk of cerebral palsy, of babies not developing to their full potential. There have been various studies showing that the brain of babies exposed to tobacco during pregnancy don't develop as well, and that their IQ, their intelligence, can be reduced by 6 to 15 points, depending on the study. So this can permanently affect how well your child does throughout its life. That being said, if it were easy to avoid smoking in pregnancy, then no one would be smoking. So there are a lot of support systems in place to help you cut down on your cigarettes and reduce them. A very simple first step is to smoke half your cigarette and throw it away. Be surprised at how much you can cut down right away, but really reducing isn't as valuable as eliminating the cigarettes, and there is no harm to completely eliminating. It's certainly not easy. In my experience, people quit smoking completely when something scares them. It scares them substantially. So I'm trying to give you enough information to give you some concern, but I encourage you to seek this out with your provider. I also want to let you know that while initially vaping seemed to be a path to go away from smoking and to slowly reduce nicotine, there are also some concerns and risks with vaping in pregnancy, and it's more of an unknown, and that still nicotine in there or other substances can potentially even cause more harm. Remember, you're breathing for two, and it can damage lungs. So I would not consider that a great, safe alternative. I hope this has been of help to you, and I hope you will work with your healthcare provider to eliminate tobacco use and smoking in pregnancy. Good luck.